Hello Bell's Palsyers. Today I would like to talk to you about self-massage and the importance of self-massage as part of your treatment for Bell's palsy. As you know, with Bell's palsy, as you might be experiencing right now, you can have many places on your face, and all those muscles are controlled by the facial nerve that are going to become progressively stiff. And that's from the lack of movement, from the lack of contraction of the muscle. You're going to have stiffness and tightness, and over time you can actually, that muscle, if it doesn't get to move, you can it will also create something that's called fibrosis, and it's adhesions of soft tissue. So it could be a fascia as well as the muscle. Some recent studies have shown that with Sinkinesses, which is a complication of Bell's palsy, hopefully you are not going through this right now, but some of those studies are showing that with Sinkinesses, it is very common to see a lot of fibrotic tissue in various parts of the face on the side of the paralysis. So the idea would be, if you are working early on addressing that mobility of the tissue, it will help also decrease your chance of having Sinkinesses. So that is the idea behind that in that study, and I want to show you a few techniques on what you can do to work on your face. So I will remove my glasses, it'll be easier. So something you can do is, I would pick an area of your face that is tender, and I would just go, so let's say it's up here, which is a common one, and what I would do is just massage it slowly down, and I would not put too much pressure. It's just according to how it feels. Again, if it's very tender, then just put less pressure. I would not really use any tool, because I think there's nothing like the human hand to kind of feel what you're doing, as well as not really just smashing the tissue with an object or something like this. So just going down like this, something you can progress down to this area, as well as, for example, here. That's a common one as well that gets tight. And spending a few minutes doing this, and especially right before you're going to do facial exercises. So a trained PT will show you techniques on what you can do and the appropriate massage for the particular muscle you really need to work on, depending on your presentation, what's tight, what's not tight, which muscle you're struggling the most with. So please consult with someone. That will be really helpful. But anyway, this is really something that should be part of your routine for Bell's palsy. It actually feels quite good. But remember, it should never be painful afterwards. If you feel more pain afterwards, or you're more sore, maybe you've either done it too long. So that's why I recommend just 2 to 3 minutes per muscle at most. Again, with light pressure. Don't use any massage tools. Don't use any percussion. Just your fingers. So I would try this, and then please leave me comments if that is helping you, and if you're seeing progress with your Bell's palsy condition just from using this technique. Obviously, this is a very summed up, very short extract of what you should be doing, but I just wanted to show you this tip. If you want more details, you can private message me and comment. You can also find on my Instagram profile, you will find a link to my tutorial on how to treat Bell's palsy at home by yourself. It is 90 minutes long. It's a tutorial that I filmed last year, or earlier this year actually. And it is available for you to purchase, and it will teach you exactly on how to self-massage, how to stretch, and how to strengthen and retrain with motor control, with all the right guidance and the right tips on how to perform those facial exercises, along with more information on Bell's palsy. So it is available today. Please check it out. The link is in the bio. It's called the Bell's palsy tutorial. And leave me any comment. You can DM me, and have a good rest of the week.